A significant percentage of the adult population has obstructive sleep apnea, including military veterans. What many don't realize is that your sleep apnea can cause other medical conditions. In this video, I want to discuss how obstructive sleep apnea causes hypertension or high blood pressure. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. This is one of my latest videos in a fairly new series of videos I'm making in which I answer service connection questions that I get from military veterans across the country. And that question is fairly straightforward. And actually, I got this twice within about a week. And that is, can obstructive sleep apnea cause hypertension? The answer, if you don't want to hear why, the answer is yes. Let's talk about obstructive sleep apnea first. Very common sleep disorder, repeated episodes of partial or complete upper airway obstruction during sleep, intermittent what we call hypoxia or low oxygen levels, frequent arousals or waking up during sleep, even if you don't remember them. And then, as most people with sleep apnea know, very fragmented sleep. Now, hypertension or high blood pressure is a condition where the force of the blood against the walls of the artery is consistently elevated. That increases your risk of heart disease, stroke, and a number of chronic medical conditions that lead to very potentially bad outcomes. Numerous substantial medical evidence has shown obstructive sleep apnea can directly cause hypertension or exacerbate pre-existing hypertension. It's a very important thing to think about when we're talking about VA disability claims when you want to claim hypertension as secondary to already service-connected obstructive sleep apnea. The mechanism behind it is fairly complicated, probably more than you want to know, but it's worth talking about. Obstructive sleep apnea involves, and it's linked to hypertension, involves sympathetic nervous system activation. I don't know if you know the fight or flight mechanism, but during these low oxygen, these apneic events where you have low oxygen, high carbon dioxide, it triggers your body's fight or flight response, leads to surges in what are called catecholamines, epinephrine, norepinephrine, which causes narrowing or vasoconstriction of the blood vessels and acute spikes in blood pressure. These nocturnal fight or flight responses can persist into the daytime, leading to sustained hypertension. Studies have shown individuals with obstructive sleep apnea have just generally overall heightened sympathetic tone, elevating blood pressure, and more importantly, interrupting the regulation of blood pressure. There's another pathway involved called the renin-angiotensin-aldosterone system, and that occasional or intermittent hypoxia increases the release of renin from the kidneys, leads to increased angiotensin II, back to the vasoconstriction, the narrowing of the blood pressure, but also it leads to increased sodium retention, which also elevates the blood pressure. Obstructive sleep apnea has been shown, and this affects a number of chronic medical conditions, but sleep apnea causes oxidative stress and inflammation throughout the body, which in and of itself damages the endothelial lining of blood vessels, makes it harder for them to dilate, which does what? Elevates the blood pressure. So you can see the multiple pathways that this can lead to elevated blood pressure. It also, that elevated aldosterone called hyperaldosteronism leads to fluid retention, swelling of the muscles around the vocal cords and the pharynx, worsening obstructive sleep apnea, but also potentially worsening the high blood pressure. Those arousals during sleep makes it hard to get restorative sleep, leading again to that elevated sympathetic activity with the fight or flight, the narrowing of the blood vessels, leading to this chronic situation where you have elevated high blood pressure. And there are numerous studies now, not just looking at the underlying pathways, but showing that obstructive sleep apnea independently increases the risk of hypertension. Some studies say it's 2 to 3 times higher, even after you control for age. You control for factors like obesity. And numerous studies have shown that once you start treatment, usually CPAP, that tends to lower blood pressure. And by knowing that, that shows you cause and effect. If you treat the problem and it fixes the downstream problem, pretty good evidence that there is a link, or there's a cause and effect association, obstructive sleep apnea to hypertension. So for veterans out there filing VA claims, you need to document this nexus, basically showing that it should be service connected. So if your sleep apnea is service connected, whether it's due to PTSD or obesity or an injury or whatever, hypertension might qualify as a secondary condition. You might get additional compensation. You'll need your medical records, sleep studies, and a nexus letter from a physician that can cite these pathways, cite these studies to basically make a case that it is caused, the hypertension is caused by your obstructive sleep apnea. If you're interested in learning more about the disability claims process, I have an ebook that you can get absolutely free, The 8 Most Common Reasons the VA Denies Service Connection for Disability Claims and How You Can Beat Them. I really need to shorten the title. Click the link in the description below. You can get that absolutely free. Make sure to subscribe to this channel. Click the bell to be notified when I release a new video and when I start my Veteran Nexus Letter live shows, which are great. They're once a month. I really enjoy them. Definitely join us for that. If you're interested in a Nexus letter for your injury or for your medical condition, you can click the link in the description below. You'll learn more about working with me and working with my team. We try to make the process simple. We try to make it quick, and I try really hard to write a Nexus letter that gives you the best chance of success in your claim. Thanks for watching, and I look forward to working with you.